I'm Dr. Joe, and I'm going to show you how to do this S stretch that I do, and I've been telling a lot of patients that have had glute or low back pain or hip tightness. I've been showing them how to do it, and this is a great reminder if you've been told how to do it, and also just for people that are also dealing with the same kind of problems. What you do is you try to get into this S position, S or 5. I'm going to have some pictures up here to show you every which way of how my legs are right now, but there's two parts to this stretch or exercise. The first part is an isometric exercise along with a stretch, and what you're going to do is you're going to just lean forward in this S position until you start feeling that stretch. You don't got to go too far. Then you're going to try to push this knee, so my front knee, into the ground without using your hands. So I put my hands here because it can kind of help me move that in. And I'm going to be using most of my glute muscles to push that knee into the ground, and I'll show specifically where that is in a different picture. All right, so I'm going to go down to the stretch and push my knee into it. You can see I'm trying to push my fingers down. I'm going to hold that push for 10 seconds in that stretch, and then I'm going to release it. I'm going to keep this stretch here, go deeper in that stretch. Push that knee down for another 10 seconds, release it, push down and further in the stretch, another 10 seconds of pushing that knee down, and then I like to just end it with just another deeper stretch with no knee. After that, I try to stand up as tall as I can. This is the second part. I'm going to be using my back leg, and I'll show different views of this as well. So now I'm going to try to lift that back leg up off the ground. And what I'm going to be feeling there is this muscle right outside, which is more your tensor fasciae lata, and you'll probably get more glute min and glute med muscles as well activating there. Just like that. I hold it for 10 seconds, and I do that 3 times. And then I'll switch sides. So I've had many patients say, I can't even get into that stretch. So what you can do to help that is I don't want you being like this into that stretch. So if you are one of those people, you're too tight to do it the normal way, what you're going to do is put a yoga block, a pillow, something like this underneath that leg, and that kind of helps that stretch not be as deep. And you're going to do the same thing, where you can lean forward in that stretch and kind of push that knee into the ground. And then hold it for 10 seconds, go down, hold it for 10 seconds, go down, hold it for 10 seconds. And again, for the second part, that pillow is important because I want you to be up on your pelvis really well, a good neutral spine. And I'm going to lift up that leg in the back. Hold it for 10 seconds. Lift it up again for 10 seconds. And of course, do it 3 times and on both sides. I'll show you on the other side. So I have this again. I'm trying to stand up tall. I'm going to lean forward. Push that knee in the ground for 10 seconds. I'm not going to release this stretch though. I'm going to push for 10 seconds. When I'm done with that, further into the stretch, push down for 10 seconds. Lift up that, or relax the knee, push forward again for another 10 seconds. And then go just deeper one more time with that stretch. And then again, second part, stand up really tall, lift up that leg. Some people say they can't even get their leg off the ground for that second part. Well, that's okay. Activating the muscles in order to try to do that is still going to do what we want it to do, which is get that benefit and those muscles starting to fire up. So keep trying, and then you'll notice that you're going to get more range of motion over time. And also, sometimes one side is easier to do part 1, and then the other side is easier to do part 2. So just keep that in mind. If you're having pain, it's normally because of some kind of joint dysfunction or muscle imbalance that is causing you to have that kind of pain and problem. So just keep working on that on both sides for both parts, and you'll see a lot of improvements quickly. So the muscles that we're specifically focusing on are the tensor fasciae lata, which is right out here, then your glute med and glute minimus muscle that are kind of the outer glute muscles that help stabilize your pelvis. These are important for lateral movement And then also important for even just if you're going straight on, like on a running, it's important to stabilize that pelvis from not shifting like this when you're running, and so you can have a straight stride and, you know, be able to run biomechanically well. These muscles are important to kind of make sure that they're firing, because if they're not, along with the glute muscle, what happens is your low back muscles have to work overtime, and then also so do your hamstrings. So those end up being tight and then causing things to be pulled out of alignment elsewhere, and also just pain in general. So if you're having low back pain, hip pain, SI joint pain, IT band pain, this might be the exercise that can help.
Chiropractic is great, and so are you.